everyone, and thank you for joining today's educational webinar with Cancer Support Community Los Angeles. I'm Kathy Riley, the Associate Director of Programs at CSCLA, and I'm really honored to welcome you to this week's webinar on the topic Tools for Navigating Your Cancer Journey. Before we begin, if this is your first time joining us, Cancer Support Community Los Angeles is a premier nonprofit organization providing vital social and emotional support to families facing cancer. And that includes patients and caregivers and their loved ones, all at no cost. Our programs include support groups and healthy lifestyle classes, social activities, and educational programs such as this one. If you would like to learn more about our services or watch past webinars, you can visit our website at cancersupportla.org. And before I introduce today's speaker, please note that your video and microphone are automatically disabled for this webinar, but we encourage you to enter your questions into the Q&A feature found at the bottom of the Zoom window at any time. Questions will be answered at the end of our presentation. We may not be able to get to all your questions today, but our presenter will share his contact information at the end of the presentation. And then I want to introduce our speaker, Dr. Philip Chang, who is an assistant professor practicing cancer rehabilitation medicine at Cedars-Sinai Medical Center. Following completion of residency in physical medicine and rehabilitation at SUNY Downstate, he completed a fellowship in hospice and palliative care at Montefiore and a second fellowship in cancer rehabilitation at the University of Michigan. He has presented his work at national conferences, is published in several peer-reviewed journals, and is the chair of Program Development and Advocacy with the Cancer Rehabilitation Physician Consortium. And it really gives me the greatest pleasure to welcome Dr. Chang to our educational webinar today.
Thank you so much to Kathy and Abby for inviting me to give this talk again, for organizing all this. And yeah, I'm going to share my slides here. And I just hope that, yeah, this can be useful and practical information to everyone who's joined. Okay, so all right, I think we're set. So yeah, again, thank you to everyone who's joined this afternoon. So basically, there's certainly so many different issues, that can occur on someone's cancer journey. And, some people are okay and they're able to kind of go through without a lot of problems. But for anybody that does encounter different issues or complications or side effects, there's certainly a lot of different things that can be done about those things. So what I basically want to do over the next 30 minutes or so is just share kind of what a lot of some of the more common issues are, as well as different resources that are available and different kinds of treatments that are available, and who you can talk to really to kind of navigate a lot of these different issues that can occur. And just I just want to also preface that, everyone's journey and kind of process going through treatment will be different. So again, not everyone will have these different issues. So don't think that all these things may necessarily happen to you or to your loved ones. But yeah, these are just things that can happen, but may not necessarily occur. So to start off with, I'd like to go over kind of common side effects that can occur while people are actively on chemotherapy and radiation. And for anyone who listened to this talk last year, this is kind of like a new thing that I added, so this might be different. But probably one of the most common things that people hear about is nausea. And there are a lot of different causes of nausea, whether it's the chemotherapy directly or anxiety related to receiving chemotherapy. If you had kind of a bad experience with the first cycle. It could be related to inner ear problems or constipation issues, or issues like with the mouth. If, for example, some people can get fungal infections with thrush. You really do need, if this is something you're struggling with, you really do need kind of physician management over this. And the people that you should really talk to and ask for if this is something that you're experiencing and it's not controlled is, number one, your oncologist. More likely than not, they usually prescribe different medications off the bat for people who are undergoing active chemotherapy. But if you're feeling like it's still not controlled and you talk to them again, you might want to ask for a referral to supportive care medicine. And a lot of times they will have tools for other kinds of tools and medications that can be used for nausea. And then also talking to clinical nutrition can be really, really helpful as well, as they can kind of help you to figure out if there's any specific foods that might be triggering nausea, and kind of make recommendations on that front. Really helpful, as again, there are so many different treatments available for nausea. So, this is just a long list of medications here that I won't go through. But again, supportive care medicine can help you trial and error these different things. And then, if you're trying to avoid more medications, there are a lot of other non-pharmacologic options like acupressure or aromatherapy. Or treating other side effects that may be contributing to nausea. So again, these are kind of the medical teams that you want to talk to, and again, a lot of the different kinds of treatments available. One of the next common kind of issues that can occur are ulcers in the mouth, and some people may not get kind of full ulcers, but you may just have like a burning sensation, usually maybe for a week after infusions. And again, we're kind of looking at some of the similar specialties here, including supportive care medicine, clinical nutrition. If it's feeling more like a tooth sensitivity, or for anybody getting radiation, particularly around the oral cavity, a lot of times that can cause teeth issues. So in those instances, you may want to involve a dentist or an oral surgeon. But again, these are kind of the specialties you want to be asking your oncologist about if you're feeling that you have these kinds of issues that are not controlled. Because a lot of times, for a lot of people, just really simple baking soda salt rinses, a quarter teaspoon baking soda with a quarter teaspoon of salt in 1 cup of warm water, and you kind of rinse that out 3 times a day. That'll be enough. But sometimes it's not. And there are other kinds of rinses that we can give, such as kind of like a thickened lidocaine, as well as different kinds of mouthwashes that can be kind of custom compounded. And there's also photobiomodulation, which is kind of increasing popularity. And this is kind of red light therapy. And there are some offices that do this, but this can actually also work very well for these kinds of ulcers. So again, these are the people you can talk to, and these are some of the different treatments you can ask them about. Other really common issues are appetite changes, bowel issues, and again, for a subset of people, right after they get their infusions, they may get heartburn or acid reflux for a few days, maybe up to a week or two. And again, you may be noticing a trend here, but supportive care medicine really, when you're on active chemotherapy, can be a really, really helpful group, as well as clinical nutrition. So if you're not following with them and you're struggling with any of these issues, I highly recommend asking for the services of these people. And then, if they're not able to help, then basically asking for maybe a referral to a gastroenterologist, who are specialists in kind of the esophagus and intestinal system and the stomach, can be helpful. Because for all these different things, there are a lot of different treatments, as you can see. So for a lot of people going through active chemotherapy, they're kind of navigating this fine line between constipation and loose stool. So, there may be times you're needing laxatives and other times you're needing antidiarrheal medications. And again, a lot of this can be managed by supportive care medicine for all these types of medications. For some people, they kind of lose their appetite, and there are various appetite stimulants, such as marijuana compounds or pharmacologic medications as listed here. For bloating issues, there are things you can do, and for heartburn, issues, there are a lot of different medications within these two classes that can be really, really helpful. So if these are issues that you're dealing with and haven't been addressed, then again, you kind of want to talk to these different groups. So I would start with your oncologist and then supportive care medicine after that. Other really common symptoms will include muscle aches. Most often, kind of leg cramps is really common, depending on the kind of chemotherapies you're getting. Abdominal cramps may be really common. For anybody who is getting injections to stimulate their blood cell counts, usually that's with a new Neulasta injection, getting pain in the bones is kind of common. So again, there's stuff that can be done for all these different kinds of pain issues. And not all of it is necessarily stronger pain medication. They may just recommend supplements with magnesium or vitamin K or more hydration or drinking more water. And then if those things aren't working, there are, of course, pharmacologic options with a variety of different medications as listed here. Again, you kind of always want to be starting with your supportive care medicine team. And then you may find that if, there's something that they feel like an additional pain specialist might be able to help you with, such as like a specific kind of injection, then they may refer you directly to pain management or interventional pain management or a specialty such as the one I'm in. Or integrative medicine, and integrative medical teams will a lot of times provide pain relief through modalities such as massage or acupuncture, or possibly through supplement use. But just note that if this is something you're dealing with, again, there are a lot of different treatment options available. And just to kind of delve a little bit further into pain, because for some people, again, not all people, but for some people after undergoing radiation and surgery, sometimes you can get kind of chronic pain issues, whether if you had like a mastectomy and you have lingering pain for months after that, or whether you had radiation several years ago and you're starting to get some tight muscle tightness in the area that you had radiation before, or maybe something, maybe you had a bone marrow transplant and maybe some of your joints are starting to ache. Again, if those things are occurring and happening to you, I just kind of listed so many things out here just to show that there are so many different options for treating pains these days. We can, a lot of times practitioners can find something that works for you if you are trying to avoid taking further, medications, whether those are kinds of injections or topicals, or more integrative practices, or, all the different kinds of modalities listed here. And I also do want to note the differences between different kinds of pain doctors. So, a lot of times we'll say, you may hear that, your oncologist is just referring you to pain management. And there are many different, it's kind of confusing, but there are many different kinds of pain management specialties. So there's interventional pain management, which usually does injections in and around the area of the spine, but also they may do nerve blocks kind of throughout the body. Then there's kind of maybe just regular pain management, and they may do kind of more management with medications. There's palliative or supportive care, and a lot of times, again, they're going to be doing kind of more medication management. And when it's needed, they may be doing more opioid management in those kinds of cases. And if it's kind of a pain issue dealing more with like muscles or bones, then physical medicine rehabilitation or cancer rehabilitation medicine may be an indicated referral there. But just so you know, again, if pain is something you're dealing with, a lot of different options for treating it. And it can't be necessarily controlled in everyone all the time, but I'm going to say in the vast majority of people, there's usually something that can help to a significant degree. Okay, peripheral neuropathy. This is common with certain kinds of chemotherapy, particularly for anybody on platinum-based chemotherapies or vinca alkaloids. This can occur where essentially you can get numbness, tingling, burning, or cramping sensations in the hands and feet. And for most people, this will get better. So if this is something that you're undergoing or experiencing while undergoing active treatment, it usually goes away after treatment finishes. But if it's not, or if it's kind of still there and bothering you, or if you finish treatment and it's still kind of lingering, then again, we want to be talking to supportive care medicine, cancer rehab medicine, or neurology, because again, there's so many different kinds of treatments available for this. one thing that we've been doing kind of a lot in our clinic at Cedars-Sinai recently is capsaicin. It's actually a prescription high dose capsaicin in terms of patches. And, I've seen patients who have tried like a bunch of different medications and acupuncture and a bunch of different topicals, and, nothing's really helped them. But, we've tried this capsaicin treatment on them, and, this might be somebody who's had neuropathy symptoms for like 10 years, and they tried this other treatment and it does work. So I just want to encourage anybody to keep trying different things, even if you have tried a lot of things, because maybe there is something out there, maybe even listed here, that you haven't tried that could be helpful. Mood changes. These are really common. And again, I'm just going to say it's normal when, someone's kind of going through a new cancer diagnosis and all the treatments that go along with it, for your mood to fluctuate. Anxiety, feelings of sadness or depression are really common. And for some people, particularly anybody who might be receiving a hormone type therapy, while for the duration of that hormone therapy, these mood changes can linger. So that's really, really common. We see that all the time. But again, there's a lot of different things that you can do for this. Some of it might be pharmacologic, a lot of it's not. But this is where we rely on our psychiatry colleagues a lot. So you can always ask for referrals to psychiatry, as well as clinical social work. And for a lot of people, spiritual care can be very helpful. So I feel like spiritual care is not something that a lot of patients may realize is an existing option, but it is available at a lot of health centers, and it's something that you can inquire from your medical teams about, and they could probably refer you. So again, it's not all just medications with antidepressant type medications. A lot of times things like acupuncture, exercise. Exercise is actually a huge one. There's tons of evidence showing that exercise can help with feelings of anxiety and depression. Psychotherapy, which is just talk therapy, guided imagery, so many of the services provided by Cancer Support Community Los Angeles. All these things can be helpful for mood changes if you are experiencing these types of things. So again, just talk to your medical teams, and they can kind of direct you on how you can access a lot of these different treatment options. Okay, sexual issues. This is something that's probably not brought up enough in visits as someone's kind of going along their cancer journey. But it is something that's really, really common. And yeah, the medical, and we're kind of aware of this, but yeah, practitioners don't do a very good job about screening for these issues and talking about them openly. So a lot of times you may have to initiate the conversation, but these are very, very common issues, whether it's decreased libido or problems with erections or problems with lubrication. Or just problems with just changes with your own body image. These are all things that can happen. So again, I would talk to your supportive care medicine teams. Gynecology and urology can be really helpful here. And then for kind of issues of body image and kind of intimacy, talking to our clinical social worker colleagues can also be very useful. And I didn't because there's so many different sexual issues that can go on, I didn't list specific treatments here, but depending on, what specific issue is happening, again, there's a lot of different pharmacologic options, as well as devices, as well as counseling services. So I just listed this here because it's not super easy to always find a sex therapist. But if you go to this website from the American Association of Sexuality Educators, Counselors, and Therapists, you can actually search for a sex therapist or sex counselor on the site, just based off of your geographic location. So if this is an issue that you're dealing with, then again, I strongly urge you to talk to these medical teams, or inquire for medical teams if these other specialty services could be helpful. And then again, checking out this website. Okay, fatigue. This is probably the biggest one. So it's kind of saying that a lot of these different issues won't affect a lot of people, and some people are fine. The one thing that I can kind of guarantee will happen is fatigue. As at some point along someone's cancer journey, this will happen. It's basically universal, occurring in 100% of people. But again, there are a lot of different treatment options to deal with this. And the main people you want to talk to are going to be your supportive care medicine teams, as well as your cancer rehabilitation medicine teams. Because again, integrative therapies, acupuncture, massage, physical therapy, exercise has been shown to help with this tremendously. A lot of people, as they're going through different treatments, they start to get problems with their sleep. So basically addressing those sleeping issues, whether through cognitive behavioral therapy or pharmacologic therapy, can be really, really helpful. Once in a while, none of these things will none of these things will help. So we can sometimes put people on stimulant medications. But just be aware that there are many, many treatment options for this, and especially for those who are dealing with kind of prolonged fatigue, like maybe you finished treatment months ago, and this is kind of still going on. I would urge you to kind of talk to these other medical resources, because maybe you need further workup. Maybe you have a low B12 level or low vitamin D level. And those are things that can kind of be repleted. So yeah, moving on, we have cognitive issues. So a lot of people may have heard the term chemo brain or chemo fog. And I would say that the most common way that this manifests is with memory recall, short-term memory recall. So if you're trying to remember the name of someone you had dinner with last week, or the name of a character from like a book or a TV show, and it's just not coming to you. And other people may have problems with paying attention to something, like paying attention to something that they're reading or a conversation that they're having with someone. All these things can occur, or even just difficulties with processing speed. So there's a lot of different things that can occur for this too. Again, these are the different groups you would want to talk to. If it's more serious, like if it's kind of like sometimes someone's confused or disoriented, they don't know what day it is or what year it is, then you might want to lean more towards neurology or neuropsychology. But if it seems kind of more like I'm feeling like a little bit more forgetful than usual, then I think supportive care medicine or cancer rehabilitation medicine may be the way to go. And again, there's a lot of different treatment options for this, whether they be pharmacologic, adaptive, retraining, or psychoeducational courses. So adaptive treatments basically refers to doing things, for instance, for somebody who is having memory deficits, to just bypass those deficits. So if you are forgetting things and you just like carry around a notebook everywhere and write everything down and take really careful notes, or you set reminders on your phone, those would be examples of adaptive treatments. And then kind of brain training treatments would be things like kind of playing memory games, or kind of brain games. And there's a New York Times article recently, a couple days ago, about kind of the role of brain, like kind of playing these brain stimulating games like crosswords or chess or lumosity games, for anyone who's heard of those. And bottom line is we think that it could be helpful. But a lot of times speech therapists and occupational therapists can help guide you through these kinds of exercises. And then psychoeducational courses are really and there's not a lot of these. The only one I'm really aware of is Dr. Asher's Emerging from the Haze program at Cedars-Sinai. But essentially, these are courses that kind of teach about the reasons why chemo brain occurs, as well as kind of optimizing everything in your body, like how much sleep you're getting and what your nutrition is and how much exercise you're getting and how you're reducing your stress levels. And kind of as you optimize all those different things within your body, it kind of gives your brain its best chance of working. And they've done studies on these kinds of courses, and it's been shown to help. So again, if this is something you're dealing with, maybe recently, or maybe for several months, or maybe even for years, again, I encourage you to talk to these different medical subspecialties, as again, there could be treatment options that can help. And then finally, bone changes and muscle loss is really is something that can really commonly occur. Most often it's because people become more sedentary, just because they're tired and fatigued, or maybe they're having some of these other side effects, so they're just not able to exercise as much. And sometimes it may be related to medications that you're on. So for a lot of people who might be on hormone therapy for prostate cancer or breast cancer, it can be really common for those that either directly cause muscle loss, and definitely to decrease bone density. And yeah, again, there's a lot of different things that can be done for this, whether medication or supplementing with vitamin D and calcium, and engaging in specific kind of high intensity exercise programs. So the people that would really be best to talk to about these kinds of issues would be rehabilitation medicine, as well as endocrinology. And they can kind of guide you through these different treatments. So with that, I'd like to briefly kind of talk about how exercise is medicine and movement is medicine, which is a phrase that hopefully people are becoming more accustomed to hearing. So exercise is really good for you, and not just because, you know, you should walk 30 minutes a day and it's just good for your body, but it it really is good for you in very specific ways. So, for example, exercise is medicine for your heart. It decreases your resting heart rate, so it doesn't kind of have to work as hard and beat as much. It decreases your blood pressure. If your blood pressure is high, if your blood pressure is already normal, it's not going to decrease it further. It'll just kind of stay at a normal level. It increases the stroke volume of your heart, which essentially means that every time your heart beats, it's able to pump out more blood to the rest of your body with every time it beats. And it also reduces the amount of oxygen the heart itself needs, because the heart is a muscle. So it kind of makes the heart more efficient at utilizing oxygen itself. So again, exercise really useful for your heart. Exercise is medicine for your lungs. And specifically, it increases your maximal vital capacity, which is the total amount of air that you're able to breathe into your lungs. And when you do this, you know, it just means that you're able to get more oxygen into your body, which basically all the cells in our body needs. So great for our heart, great for our lungs, great for our muscles. When we exercise, the energy storage areas, which are called glycogen, are increased in our muscles, so they have access to more energy. It also makes them more efficient at using that available energy. And as we all know, when you exercise, the muscle fibers actually grow, and you'll become physically stronger. And in the past, maybe 10 or 20 years, we're finding increasingly that exercise is medicine for cancer. In that not only does it help with all those other things in our body, in our heart and lungs and muscles, but literally it helps to kind of directly fight cancer. And it does this through direct effects by affecting intrinsic factors within tumors, by regulating tumor growth, by alleviating adverse events related to cancer, as well as improving cancer treatments themselves. So there have been many different studies done that have kind of demonstrated this effect. So this is a study that they did in rats. And essentially there were two groups of rats. So one group basically was kind of more sedentary, and they're just kind of sitting around or standing around for most of the time, whereas the other group of rats had free access to a running wheel, so they could run as much as they wanted to. So that was the only difference between these rats and, you know, the placed lung tumors within these rats. And you can just see in the group, these black areas are the tumors. And within the group of rats that did not exercise, that are more sedentary, that their tumor volumes were much larger than compared to the group of rats that just exercised more, just ran. This is another study that they did in healthy young men. So these are men without cancer. But they basically had these healthy young men get on bikes to do high intensity exercise training. And after they did the cycling, they took their blood and they took the serum from the blood and they exposed it to human lung cancer cells. And what they found is in the serum, there were factors within the serum of the blood of these people who just exercised, which basically inhibited the ability of these human lung cancer cells to proliferate and survive. So just increasingly, we're finding all these mechanisms of really how exercise can enhance our body's immune system to fight off cancer cells and tumor cells directly, as well as mediating inflammatory effects. And this has been shown in several different studies, as we see that people who exercise regularly have reduced risk of developing all these different kinds of 7 cancers here. And for people who have breast cancer, there's a 48 risk reduction in all-cause mortality, 42% risk reduction in all-cause mortality in colon cancer, 38% risk reduction of mortality in prostate cancer. So, these are really, really big numbers. And the only thing is if you are exercising. So hopefully everyone is wondering how much exercise they should be getting. And here's the answer. So essentially we're looking for 3 times per week of kind of 30 minutes to 60 minutes for a total of 150 minutes per week of moderate intensity aerobic activity with 2 to 3 days per week of strength training. And then aside from kind of the direct benefits of fighting cancer, you have all these other benefits, and there's strong evidence that helps with fatigue. It helps with physical function, anxiety, depression, as well as lymphedema, and moderate levels of evidence that helps for bones as well as sleep. So for anyone who's able to exercise, it's highly encouraged. If you're not sure if it's safe for you to do, you can talk to your medical teams and your oncologists, and they'll kind of be able to tell you. But with that, I want to kind of go over various rehabilitation resources that may also be helpful to you as you go along your journey. I just want to briefly explain what each of these is, as well as what kind of services they provide. So probably the thing that everyone has heard of is physical therapy. So physical therapists can really help if you're having any difficulties with walking, getting up from a chair, getting up from a laying down position. If you have difficulties with range of motion, for anybody who has undergone surgery to the neck area or the chest area. A lot of times people get less decreased range of motion in their shoulders, so they can help with that. A lot of times they will use different modalities, including superficial hot, cold, ultrasound, or electrical stimulation. And they will use strengthening exercises, stretching exercises, as well as various manual therapy, soft tissue techniques, where they kind of get in there with their hands. And if you have an area of kind of fibrous scar tissue, they can help to kind of massage it out, make it looser. And that helps really significantly a lot of people. Depending on the kind of physical therapy you need, it may be available like really close to you, kind of at a private office, or if it's, again, something like scar tissue massage after a mastectomy, that, you may have to see kind of more specialized physical therapist for that. But regardless, these kinds of therapists can help with a variety of issues. Pelvic therapy. So pelvic therapy can help with problems of anybody who may be struggling with like urinary incontinence or bowel incontinence or has pelvic pain, or for a lot of patients who may experiencing difficulties with sexual dysfunction. And they will do kind of instruct patients in doing pelvic floor exercises to strengthen all these muscles here that kind of help to prevent incontinence. They can utilize, again, kind of manual therapies where they kind of get their hands to massage out kind of very stiff areas, as well as electrical stimulation. So if you're having any of these kinds of issues, I highly urge you to seek out services of a pelvic therapist. Occupational therapy is kind of the second big therapy next to physical therapy. And a lot of these therapists will basically help for anybody who is having problems with activities of daily living. So this will include things like if you're having trouble showering, or feeding yourself, or putting your socks on, or putting your shoes on. They can help you relearn how to do these things. And a lot of times they'll focus on strengthening of the arms and the upper body. So again, strengthening and stretching those upper body muscle groups, as well as kind of utilizing a lot of the same modalities and soft tissue techniques that physical therapists use. Hand therapy is a specific subspecialization of occupational therapy, and they will focus on hand function. So for example, anybody that is having stiff hands or painful hands from therapy, hormone therapy related to breast cancer, especially for anyone who is on an aromatase inhibitor, or anyone who's kind of been thrown into menopause during chemotherapy. Hand therapy can be really, really useful if you're kind of feeling stiffness and pain in the hands, and they utilize these kinds of heating modalities. This is paraffin wax, where they just kind of brush hot wax all over the hand to help kind of loosen up the different muscles. But they can help basically to regain motion in the hand, regain strength in the hand, as well as regaining fine motor coordination. So for anyone who's having difficulties with like writing, typing, texting, they can kind of show you the different exercises that you can go through of helping with these kinds of things. So occupational therapists and hand therapists are not as commonly available as physical therapists are. So it's more likely than not that you may have to seek out their services at a larger medical institute. But again, if you ask for it and you look for it, it will be there. Lymphedema is another kind of specialized therapy service. So certified lymphedema therapists usually undergo extra training after completing school in physical therapy or occupational therapy. So lymphedema is basically when you have swelling of like an arm or a leg or an area of your torso, usually after having lymph nodes removed or undergoing radiation therapy to an area of the body. And lymphedema therapists can basically help to calm down the swelling. And they do this by doing something called complete decongestive therapy. And the main thing that they do is lymphatic massage, but they'll also help with showing you what kind of exercises you can do, how to take care of your skin, as well as fitting you for compressive wrapping and garments to help reduce the swelling. So lymphedema therapists also harder to find, but this is a website you can go to. This is one of the certification bodies for lymphedema therapists. So this is cltlana.org, and you can type in your zip code and find a certified lymphedema therapist in your area. Speech language pathologist, again, a little bit harder to find than physical therapists, and you may have to look at larger medical institutes. But for anybody who's having trouble swallowing, or anybody who's having trouble talking, but more often than not, what I use them for is anybody who is having severe kind of brain fog issues, severe memory issues, severe speaking issues, severe attention issues, then speech language pathologists can be very, very helpful. Again, a lot of what they do is kind of assessing swallow function, but they do quite a bit of cognitive evaluation and training as well. And then lastly, neuropsychology is probably the specialty that people might be the least familiar with. So neuropsychologists specialize in the relationship between the brain and cognitive, emotional, and behavioral functioning. So essentially, if you go to see a neuropsychologist, they will go through an extensive battery of tests with you lasting hours, and they will assess every domain of your brain functioning, like reading, learning, processing speed, memory, all these different things, and they will be able to kind of help delineate, number one, if you are above or below your personal baseline, if you've had this testing before, and where you kind of stand relative to kind of the average person, how they do on these tests to see if you actually do have deficits. And then more than that, they can kind of help to tease out specific causes of those deficits and recommend pathways of dealing with those deficits. So for anyone who, again, who is having more severe deficits beyond, kind of not remembering, the name of someone or something, a neuropsychologist may potentially be useful, and it's something that you can ask your medical teams about if that could be helpful to you. So again, how do you access these resources? Just talk to your providers. So for example, a lot of physical therapy and occupational therapies, for those who are kind of too tired to leave their house or unable to leave their house for any reason, some of these services can be provided at home. Lymphedema therapy, speech therapy, the specialized therapies, like pelvic therapy, those are harder to find at the home setting, but once you can get to the outpatient level, and you can kind of go, do these therapies somewhere else, then they are much more easy to find. So, if you're looking for any of these services or think that they can help you, just ask your providers and they can refer you to them. Lastly, I'd like to just kind of talk about cultivating kind of a culture of wellness and resilience. So there are so many things as someone's dealing with like a new cancer diagnosis and dealing with all the effects of treatment that can occur, and just so many different things that can lead to stress. And there are also so many things that can help to alleviate these things. So this is just, a bunch of the resources available through our wellness, resilience, and survivorship programs at Cedars-Sinai. We have like mindfulness classes and art therapy and nutrition classes and different exercise programs. So it's very likely that wherever you're receiving your care, these kinds of things may be available too. And again, there's also clinical trials for these different kinds of things that cancer rehabilitation medicine providers may be running, or integrated medicine specialists may be running, or oncologists may be running. So you can also ask your providers about clinical trials. And then there's so many community resources for this. So Cancer Support Community, as Kathy was saying earlier, they provide so many different really excellent classes to kind of cultivate wellness and resilience in this space. And then there's a bunch of other ones too, Magnolia House and WeSpark and CanCare. And this is just some of the different services and classes they offer. So, for example, this is one of the educational events, but again, all of these things listed here that I won't go through are a lot of the great things that they do that can be really, really helpful to people. So I encourage everyone to just, it's simple as typing in a Google search of Cancer Support Community Los Angeles and, finding all these different resources. So and that's all I have for this session. So I'd be happy to answer any questions now. And my email's listed here for any questions that I'm not able to address, or if somebody thinks of something later. Thank you so much for your attention.
Dr. Chang, thank you so much for your presentation. I found it so informative, but also meaningful for the journey that I hear so many of our participants going through, and appreciate the breadth and the scope of all that you shared. So thank you. We do have a couple of questions that have come in. Someone says that they've had endometrial cancer and have lymphoma in the legs, and would like to see a lymphedema doctor that understands the lymph system. And in particular, it sounds like there are issues with one leg that are not resolving. And are there any tests, MRIs or CT scans, that can tell if your lymph system is working correctly in your body?
Yeah, so that's a great question. Thank you so much. So yes, there are imaging modalities that can be done. The first test that somebody may want to order for you, if this is relatively new, is actually it's called a venous duplex ultrasound, where they do an ultrasound of your leg, and that's actually to rule out a blood clot, because that's like the major thing we want to make sure is not there, because that could be potentially very serious. And if found, you may need to be put on blood thinners. So that would be usually the first test that I would order if, we're not sure that this is lymphedema. Now, if, say you had that kind of test ordered and there's no blood clot, then the next test that I would ask for is a lymphoscintigraphy. And that is essentially a test where they will inject a dye in between your toes, and then they will take images to see how that dye is taken up by the lymphatic system. And that is considered currently still the gold standard test for diagnosing lymphedema. And if that is found to be positive, then yeah, you would want to pursue therapy with like a lymphedema specialist. And increasingly these days, there are some other options such as compression devices, as well as some surgeries that some plastic surgeons are starting to do now.
Great, thank you. And then I just want to encourage everyone present to go ahead and type your questions in. We've got a few more minutes for questions, so feel free to type them into the Q&A at the bottom of your Zoom window. And a comment from someone about paraffin wax bath on Amazon. They have it, and it's great for your hands and feet. And so I don't know if you want to comment on that and those home remedies and sort of what you recommend.
Yeah. So I mean, yeah, a lot of the stuff Amazon is amazing because you can just find anything on there. So yeah, for stuff like paraffin wax, it can be really, really great. It just really depends on whatever the specific kind of issue you're dealing with. So yeah, again, if it is something like hand arthritis, or hand pain, yeah, these paraffin wax can really be great. For a lot of people, if they're looking for braces, like if they have like back discomfort or like hand discomfort, sometimes, or like, knee arthritis, a lot of times braces like from Amazon, you can kind of try yourself. You just want to be a little bit careful with that kind of thing. just because if you wear it for too long, it can worsen some conditions for kind of more than a few hours per day. But if you want to try it, yeah, I think more often than not, it's relatively harmless.
Great, thank you. Another question about neuropathy in the feet long after chemo has ended. And not pain, but numbness and tingling causes walking with a wobble and depending on a cane for back up. What can be done?
Right. So the first thing I would want to find out is if your neuropathy symptoms have been worsening. So if they've been kind of the same since you finished chemo, then I think, you can start to assume that all of it's from chemo and just address it as it is. If it's been worsening, that should not be necessarily happening after you finish chemo. So I would talk to your medical providers and possibly a neurologist about looking for other causes, as there are many, many other causes besides chemotherapy that can cause the same kinds of issues. Most commonly, like a B12 deficiency, or diabetes or pre-diabetes even. So yeah, if it's worsening, I would talk to a neurologist. If it's kind of been the same and everyone knows that it's from the chemotherapy that existed before, for balance training, what I basically tell people is we all have a potential that we all have some sort of physical potential with regards to how good our balance can be within the confines of how well our nerves are working. So, that potential may be decreased somewhat in somebody who has neuropathy from chemotherapy. However, unless you're doing balance exercises and leg strengthening exercises regularly, it's unlikely you're at your full potential right now of how good your balance can be. So what we always do is we refer people to physical therapy, and they'll do a bunch of different balance exercises with you of having you stand in different positions or standing like on one leg and seeing how long you can hold that for. And as you do those repeatedly, your balance can improve. Now, it is true that you'll reach a plateau, again, based off of, how much nerve damage there is. But if that's something you haven't done in a while, that's something I would pursue physical therapy just so you can make sure that you're kind of at your full potential. Regarding symptoms of numbness and tingling, we divide symptoms into two categories, negative symptoms and positive symptoms. Negative symptoms are things that you lose, such as your sensation, that would be numbness. That's something that honestly, there's not much we can do about. Now, positive symptoms are like symptoms that you gain, so new sensations that are there, and that would be like tingling. There's a lot that can be done about tingling. I think these slides will be sent out to anybody who asks for them. So I'd urge you to look back on my slide about peripheral neuropathy, and they'll say a bunch of the different kinds of treatment that are there. But just to kind of list them briefly again, there's photobiomodulation, which is red light therapy. There's acupuncture. There's scrambler therapy, which is available at UCLA and some private offices. There are multiple different kinds of pharmacologic medications. And then I think I talked briefly about high dose capsaicin patches. But yeah, there are multiple things that can be done for that, or tried at least.
Great, thank you. And then a question about, could you talk a little bit about more about acupuncture and does that help neuropathy I think this
Yes.
question was like I think in legs.
Yes, so there is evidence that acupuncture can be helpful for neuropathy. It's not though like you can go once, like try it one time, and if it doesn't help, then yeah, you would write it off. Generally, I think most, don't quote me on this, but most studies, I would say people are going like once or twice a week for 6 to 8 weeks. So I'd give it like a fair shot. But yeah, there are definitely studies out there showing that acupuncture can be helpful for neuropathy symptoms.
Great, great. And then another question, I think this is really important. If you feel like your oncologist is not taking your side effects seriously, is that a sign to switch oncologists, or would finding a supportive care team be enough to solve that issue?
Yeah, that's a really important question. It doesn't have a straightforward answer. Um, so number one, I think you have to trust your medical team, whoever that is. Like if you don't trust them, then I think you have to find someone else. But let's say you trust them, and you feel like they're doing like the right thing for your cancer treatment, and maybe, they're just not paying as attention or as much attention to kind of some of these other issues. then yeah, just ask them for a referral. And I don't I've rarely encountered an oncologist who would say no to that. So yeah, you could just ask them for a referral to either interventional pain or supportive care medicine or palliative care or kind of any one of the various specialties that we talked about, and they should do that for you. If they're saying no, they should either be able to give you a very good reason that makes sense to you, and if not, then yeah, in that case, I might consider switching. But again, it just depends on your unique situation. And, I think you had to trust whoever is taking care of you.
Yeah, yeah, that's a great point. A question about hyperbaric oxygen or ozone therapy of any use in any cases on one's cancer journey. Is that helpful? And if it is, in what cases?
Yes, so hyperbaric oxygen can be helpful. Most often, it's used for instances of wound healing. So usually for someone who's undergone surgery or radiation, and they have open wounds, and it's, it has very slow wound healing, then it may be worth it to talk to your radiation oncologist or your surgeon about a referral to hyperbaric oxygen therapy. It's very expensive. It's not often covered by insurances, but some insurances will cover it. And it's fairly time intensive. The protocols are, you may have to go for like 20 or 40 sessions over the course of like a few months. So it can be time intensive. But again, for wound healing, yes, it has definitely been shown to help. And a lot of surgeons will kind of recommend and advise it. The other thing that there's been more recent evidence about that it could potentially help with is for breast cancer patients who underwent radiation therapy for breast cancer and who may have shoulder restriction issues or mobility issues and possibly discomfort. There was a recent study, I think it was released last year, that did show that hyperbaric oxygen was able to be helpful for those types of issues as well.
Great, thank you. And then just a clarification of some of the terminology that's used. I think it's helpful for all of us in moving forward. We talk about supportive care medicine and palliative care and rehabilitation medicine. And could you provide some guidance about, are there differences in those teams? And if so, what are the differences? And then perhaps, you've talked a lot about supportive care medicine. Who would be on that team? Just to provide some guidance about uh, so that we know where to go for the.
Absolutely. Thank you so
Yeah.
much for that question. You're right. I was not very clear about that in my slides. I kind of use them interchangeably. So I really, really appreciate that question. So supportive care medicine and palliative care medicine are the same thing. Those terms are
Okay.
interchangeable. And really, if you want to look into the history of it, it's rebranding. So, palliative care medicine was the original term, and a lot of different institutes will still use that term. They'll still call themselves palliative care. It was rebranded kind of to supportive care medicine. I think first that happened at MD Anderson in the 2000s. But it was just because a lot of people start to kind of associate that. You know, yeah, there's just kind of some miscommunication about associations with palliative care and okay, it's time to go on like hospice or something. So therefore a lot of people would kind of avoid it, even though that's not what palliative care is. So that's why a lot of places are now changing the name to supportive care medicine, which I would say is a more accurate term because, they're not there to put people on hospice. I mean, that's part of what they do, but I would say that's, a smaller part of what they do. Really what they are there to do is support you with any symptoms that you're having during treatment or afterwards, whether it be with pain or nausea or bowel bladder changes. They're just there to help with any symptoms you're experiencing. Rehabilitation medicine, that's a little bit newer and different. There aren't actually that many cancer centers with cancer rehabilitation medicine currently, but it's increasing a lot. It's actually kind of exploding in popularity in past like 10 years. So that I would say is more focused on specific issues of the neuromusculoskeletal system. So again, things like difficulty with balance from chemotherapy neuropathy, or ongoing fatigue, or leg weakness or muscle weakness, or cognitive issues. And yeah, I would say also more of the survivorship issues kind of that I was discussing. So that's a separate category than, yeah, like palliative care and supportive care medicine. And then, but I would say that there is also considerable overlap between the two. So it definitely can get confusing.
Yeah. Well, thank you so much for that guidance and for the clarification of those terms. Well, we have unfortunately reached the end of our time together, and thank you so much again for this informative presentation, Dr. Chang, and just for spending so much time with us answering questions as well. We really want to thank you, and to thank our participants today, those of you who have engaged with us and been a part of this webinar. We really thank you for that. And Abby, I think you've got a final slide that you're going to share. And while we're doing that, I want to let everyone know, and I saw some comments in the Q&A, that Dr. Chang is graciously going to share his slides. So if you would like a copy of today's slides, you can email info at cancersupportla.org. If you want to learn more about Cancer Support Community Los Angeles programs and services, you can visit our website at cancersupportla.org. And then along the lines of some of the classes that Dr. Chang addressed today, we wanted to let you know about an in-person restorative yoga class that we have at Cancer Support Community Los Angeles. It is every Tuesday from 1 to 2:15 p.m. If you're local and looking to be part of a class like this, we welcome you to attend, and you can scan the QR code here to register. And with that, I want to thank everyone again for your participation and for your thoughtful questions. And we hope to see you at a future webinar. Thank you and have a great weekend.